Welcome to Medicine Handy Point. Today we will discuss indication for starting GLP-1 agonist drugs in diabetic patient and latest from NICE guidelines. So let's start that. So GLP-1 agonists, how they work, let's discuss that. Actually, GLP-1 agonist, which is actually glucagon-like peptide 1, they stimulate insulin. Naturally, GLP-1 agonists are found in the body. When we eat the food, these GLP-1 agonists are released from the gut and they stimulate the insulin. They slow gastric emptying and lower food intake. So when your stomach is full, you will decrease your intake. So it helps in weight loss. And it inhibits glucagon. Glucagon actually increases the glucose level in the body. So it inhibits the glucagon. So this is the three wave how the GLP-1 agonist works, and ultimately it lowers the blood glucose level by acting through these three mechanisms. And these are the five GLP-1 agonists available. This include lexasenatide, exenatide, semaglutide. Semaglutide is available in oral form as well, dulaglutide and liraglutide. All others can be given as a injectable form, while semaglutide can be given as a oral form as well. So now let's discuss the indication for starting GLP-1 agonist in diabetic patients. So if the diabetic patient is already taking triple therapy, which includes metformin and two other oral drugs, and it is not controlling his or her diabetes, or the triple regimen cannot be tolerated or is contraindicated, then we should consider switching one of the drug from the triple therapy, and we can start GLP-1 agonists. So ideally we should look for the body mass index. If the body mass index is more than or equal to 35, we should definitely switch one of the drug from the triple therapy with GLP-1 agonist. So this is the first indication. Now, in case if the patient has BMI lower than 35, and we can start insulin because of the occupational implication, means the patient is a truck driver and travels on a long route all the time, so insulin can cause hypoglycemia in these patients. We cannot start insulin, so we can think of starting GLP-1 agonist rather than insulin, because GLP-1 agonist does not cause hypoglycemia. Or weight loss will benefit other significant obesity related comorbids. Or we can also consider starting GLP-1 agonist because it helps in weight loss, that will help in a patient who are obese, and obesity related complication can be reduced as a result of GLP-1 agonist, one of which is if the patient is having osteoarthritis, severe osteoarthritis, cannot walk because of the severe obesity, we can start GLP-1 agonist that will help in reducing the weight, and the patient will also have improved glycemic control with that as well. I hope you like the video, and please subscribe to the channel.